Thank you very much also to the interpreters team. It was not always easy, but I think that we were clear enough so that you worked in good conditions. Thank you also to the organizing team that did a lot of work backstage and anticipated. So thank you very much to them as well. And also to the speakers for preparing their interventions here. Even though we had to be a bit tough at times so that we kept up with schedule. There's something that might be a bit complicated, that is between the ideas shared on global issues, then getting into more specific issues. It's not easy to find the same wavelength. But I think we can work also on improving this. And thank you also to the participants here who made this debate so lively. So, Matthew, you have... sorry, thank you, Matthew. I'm a bit like an observer. Well, radio frequencies is... my field, so I know very well risk assessment. I enjoyed very much this day.
Les chercheurs.
We told the researchers that they had 10 minutes to present their work, which is practically impossible. And then there were questions. There was some interesting dialogue with the researchers, and we have to keep working on that. So, what do I take away from this? It's always very difficult to do epidemiology on new technology because there are no new cases. I saw several times that anticipating risk is not something that's in the mindset of inventors. The inventors say, "We'll first we're going to perfect the technology, and then we'll look at the risks." Of course, we can't move faster because this is... But it's not a very good idea to lose 5 or 10 years because we have to move more quickly. So the paradox is that innovation is deployed even before the population is worried, and it would be more intelligent to anticipate as much as possible. Mobile telephone in technology is complicated because we keep looking and we're not finding much. And this is not easy for the researchers. I know that if you want to write an article for Nature and get a prize, you'd better find something. You'd better find some results. So congratulations to those who are working on this, because they're working for the common good and not for their own glory. And the statistics on this are pretty complex. It's complicated to understand what this is all about. We don't have a lot of good data on exposure, and all of this comes into play in a context where there are other sources of disturbance. I've been talking about air quality issues for 30 years, and on that issue we clearly have deaths and we have results of studies, and we're still late, and it's not because we're not looking at it. When you talk about air quality, we're the knowledge is 20 years ahead of the public policies that are potential. And it's just like diesel engines. For years, we pushed people to buy diesel engines, and now we're saying that this is going to be illegal. And then there are endocrine disruptors, the use of pesticides, etc. Then there are addictions, there are problems, addictions, and inequality that's increasing socially from a social economic point of view. So regulating radio frequencies is nearly impossible, and what we see is that public politicians are not taking the necessary steps because they're just not going in the direction of common good, even when we know what they need to do. So imagine what happens when we don't have the information. So what is the solution? More research. We've heard that several times. So first of all, we need to congratulate this program. It's difficult to continue doing research in a world of science which is turned more towards innovation than it is to research. We need more anticipation. I said this about technology as well. So we have to ask ourselves, what would happen if there were people regarding GMOs, people asked questions that seemed to be irrational, but in fact, they said the risks seemed minimal, but what are the advantages? If there are risks but no advantages, then we don't need to develop that innovation. But if there are advantages, and there certainly are with the mobile phone technology, then we should go. 5G probably does represent advantages, but should we be going straight for the wall on that? We have to have people asking the question of what we want for the future and what the role is of a form of technology that we certainly do not know everything about. And these are serious questions that we need to be dealt with. We need additional consultation. When you talk with citizens who raise questions, then questions come up, and the researchers hadn't thought of those questions. And the dialogue between Priortem and the WHO is interesting because there are questions that come up, and these questions are not stupid. And then they have to transform those questions into research projects. I'm also the president of an association. It's called Alliance of Science and Society. And we want people to have access to research. Doctorate students, for example, who want to do research, and not to replace the academic world, but to give new input, because researchers can't think of everything. And consultation is also useful for sharing results, as we can see today. It also creates trust through dialogue. If you look on internet, it gets aggressive because people are not face-to-face. When you're talking to someone face-to-face, you respect the person, and we respect each other. But when you're not face-to-face with someone, you can just throw out whatever insults come to your mind. So dialogue is a way of creating trust. It's also a question of common good. I don't see a lot of results showing radio frequency coming up with serial results. except when it comes to children and babies, for example. Hearing about parents putting cell phones in the incubator to help them listen to music. I don't know if that's a good idea. I know that when my wife was pregnant, we used to sing in a chorus, and when the cymbals would clack, the baby in her belly would move, and so that means something. And so, given that babies' brains are fragile, we should apply the principle of caution and find solutions so that healthcare workers can be reached without them using their portable phones. I don't think that we would lose a lot when it comes to that sort of caution. Dialogue is also about participative science. We have to get people involved and get them to tell us what they think. I could have said a lot more than that, but I think that it's about time to go home. So I'd just like to thank ANSES and to the International Center for Cancer Research. Thank you to you all for coming and for participating in the discussion. I'd like to thank the researchers on our panels who were able to make their presentations in 10 minutes. Just one suggestion, start with the results. I know that's not what you do when you're a researcher, but if you start with the results, then you'll have time to explain how you got to those results, and you'll see that it will be much more lively and effective, because in 10 minutes you have to suddenly jump to your results, and it's frustrating to everyone because everyone knows that you want to talk longer. So thank you, and thank you for the associations for being involved, for asking questions. There are no bad questions.